I'm Dr. Cole with Mid-Atlantic Chiropractic. I've got Ryan here. We're going to do a adjustment, hopefully get his low back feeling pretty good. With what he has going on, we have a little bit different of a pelvis. So typically what we look at is just the leg length here, but he actually has some internal and external rotation of his iliums. So one of the things I like to do is we'll do a little bit of distraction for the femur here, pulling down, and usually get a little bit of talus in there as well. Good. Same thing. And one more time on this side. Good. And just by doing that distraction on his femurs, we do see that it does come back to a normal length here. But another thing that I look at is his actual glutes here. And so when we're seeing a glute that's higher on one side than the other, we know that we have to do some form of internal rotation. And so that's what we'll be doing here on the left side. So that means I'm going to have Mr. Ryan cross his right ankle over the left. Perfect. And we're going to go down and in on the left here 3 times. Good. Good. And then on the right, we're going to come up and out. So we're rotating the pelvis down, but also providing external rotation here. We'll do that 3 times. And so having the leg crossed actually assists me into bringing that into external rotation. So he's going to uncross here. We double check that he stayed even, which he did, which is phenomenal. The next thing we have to do is open up his L5-S1 here. And so the best way to do that is counter nutation. I'm going to have you take a big deep breath, hold it, exhale. Very good. And again, big deep breath, hold it, exhale. Very good. One more time, big deep breath, hold it, and exhale. Good. So the next thing on the list is we know that he has some DDD or degenerative discs at L1 and L2. And so one of the things we're feeling for is extension here. And so I'm going to have him take a big deep breath all the way out. Good. And again, big deep breath all the way out. And one last time, big deep breath all the way out. Good job. All right. So now we're going to do extension for the thoracic spine. So Ryan, take a big one in, all the way out. Good. Excellent. One more. All the way out. Good. All right. We'll have you go onto your back now. For the cervical region, I typically use what's called supine diversified here. And so when we're palpating the neck, the number one thing we're looking for is going to be tenderness over that transverse area and the lamina pedicle junction or lamina pedicle junction. And Ryan's got a lot of muscle to work through here, so it's a little bit more difficult, but found a couple spots. Is that tender there?
Yep.
Okay. So what you're going to see me do is more of an extension move here. So we're going to come up and over. I'm going to have him take a deep breath all the way out. I'm going to relax that shoulder. Good. Fantastic. And then up top, same thing. I want you to relax that left shoulder. Good. Fantastic. Very good. And then I always finish off with a little bit of distraction for the neck to help open up those discs. Awesome. All right. That's another adjustment with Mid-Atlantic Chiropractic. Thank you guys.
I feel great. Thank you, buddy.
Yes, sir.